Good afternoon, and welcome to our Mapchats today on advancing early childhood education through data and mapping. My name is Kristen Crandall, and I'm a senior data analyst here at PolicyMap. For those of you signing on to Mapchats for the first time, PolicyMap, the organization behind this webinar series, is a national online mapping service. And Mapchats is a free webinar series that features experts from a variety of topics, such as housing policy, healthy food access, creative placemaking, and more. Our speakers discuss how their work incorporates data and maps, giving our audience a chance to see firsthand the indispensable role of maps in the everyday work of policymakers and practitioners. So today we'll be talking about early childhood education, and we will hear from 3 experts in the field about how they use data and mapping in their work. Early childhood education is certainly a hot topic of conversation all over the country right now. There's a growing understanding of the long-term benefits that quality early care has on children, families, and communities, such as increased high school graduation rates, higher employment rates, lower crime rates, and decreased public health care and welfare expenses, just to name a few. Race to the top and the growth of quality rating and improvement systems have further fueled conversations about the need for strategic decision-making around early childhood education planning. So today on Mapchats, we're going to dive into how government agencies, foundations, policymakers, and other organizations are using data and spatial analysis to understand the childcare landscape and to start thinking about and implementing appropriate interventions. We will start with a presentation by Carlise King from Child Trends, and then we'll hear from Michelle Canavino from PRE4CLE in Cleveland and Elliot Weinbaum from the William Penn Foundation in Philadelphia. Before we dive into the presentations, just a little housekeeping for everyone. So everyone is currently muted. If you have questions during the presentations, please use the GoToWebinar panel. Just type into the control panel and we'll respond to you directly or read your question during the Q&A. After the presentations, we'll aim to leave at least 20 minutes at the end to answer questions. Surely a great deal of interesting information will be covered, so you can rest assured that the webinar video and slides will be sent out by email and available on the Mapchats website. And for those of you on Twitter, you can use the hashtag Mapchats to join in the conversation. So now that we have that covered, let's get going with the session. Our first presenter today is Carlise King, Executive Director of the Early Childhood Data Collaborative at Child Trends, where she's responsible for leading a national survey of states' early care and education data systems. She also provides research, policy analysis, and technical assistance across Child Trends' early childhood development projects to support the development, implementation, and childhood data systems. Carlise has over 12 years of experience conducting research on early childhood issues and examining the impact of state and federal policies on parents' access to child care services, licensed child care supply, child care costs, and the child care workforce. Welcome, Carlise.
Thank you, and good afternoon, everyone. I'm so pleased to have the opportunity to talk with you today. Speak with you today about how Child Trends uses data and provide an overview of how, just to share with you a little bit about how Child Trends uses data to support programs and the role that mapping plays in the work that we do. And then I'll also provide an overview of how states are strengthening their use of data through better coordination and developing interactive tools for both policymakers and consumers to inform their decision making. First, I just want to share a little bit of background on Child Trends. Child Trends is a nonprofit research organization focused exclusively on improving the lives and prospects of children, youth, and their families. For over 35 years, decision makers have used our rigorous research, our unbiased analysis, and our efforts to really clearly communicate how this research applies so that it can help to inform public policies and interventions to better serve children and families. Our team has experience working in a range of subject areas, including child and youth development, well-being, child welfare, education, health, parenting, poverty, program implementation, teen pregnancy, and youth development. Today, I'll be sharing specific examples of from our early childhood work. So one of the things that we focus on a lot is how can we plan for early childhood investments. And so there's been a lot of research on the need for additional early care and education, but a lot of states have been asking the question, as you get additional funding or as additional initiatives that are meant to expand child care and improve the quality, how do you implement that and how can you use data to do that? Child Trends has completed several risk and reach reports in which we use data to first identify family risk factors that may affect child outcomes. So on the slide here, I have an example from a report that we completed in the District of Columbia. In that report, we identified 15 family risk factors, such as areas where there's high child poverty, infant mortality rate, low birth weight, looking at data around substantiated cases of abuse and neglect, and also information around maternal education and more. I won't list all 15 of them. For all of the examples that I'm providing, I've included the sources since I can't go into detail on this particular overview, but if you're interested in getting more information about the data used and the findings from the reports, the sources are listed on all the slides. And so in using these family risk factors, geographic areas were organized as being low, moderate, or high risk, depending on the prevalence of risk factors. So those that had multiple risk factors were identified as areas of high risk. In DC, we used wards because those are really distinct geographic areas, and also districts for different areas. So depending on the state, we may use different geographic boundaries. But the mapping was really helpful in this particular project because after identifying the areas of high risk, we then overlaid what we called the REACH data points of the availability of early childhood, home visiting, and early intervention services in those areas. And what the mapping was allowing us to do was to really pinpoint where those services were in relationship to identified high areas of risk, or what we would interpret as high areas of need. In addition to thinking about the supply, the need, and then also the supply of early child care services, this thing's moving a little faster than I am, also some of the work that we do is in understanding what types of child care parents need, not just what's available, but what are parents looking for. And so there's a lot of funding to fund organizations to help parents to find child care. So in understanding what parents need as well as where they need care, not just where care currently exists, is really a critical part of how communities and states plan for child care needs. And families need information to make these informed decisions about child care usage. So this slide highlights a report that Child Trends conducted on Minnesota's Parent Aware website, which was launched in August 2014, to understand how new child care search tools were used by parents, and then also what information was being accessed as part of their child care search. So using information from Google Analytics, we analyzed over 80,000 visitors to the website during a 6-month period. And the data that we were able to collect from Google Analytics allowed us to look at the geographic location of visitors, the demographics of users, to examine the types of programs that families most often searched, and then also how people use the search tools available on the site. A lot of what in this overall report, it's looking at the implementation of Minnesota's overall quality rating improvement system and really looking at the different pieces that they implemented in to help parents to provide information on the quality of programs, but then also looking back at the behaviors of parents and how they use the different tools that were developed. We used mapping tools to show where website visitors were located in Minnesota, and this particular map allowed the state to see exactly where were the concentrations of the addresses that parents were searching for childcare, and then being able to use that data and overlay that with where the supply was. And that was able to look at where there was a high search for parents, but then where there may not be a high supply of childcare. The analysis also provided information showing that users were mostly female from the ages of 25 to 34, and that the search options that were most used to filter to find childcare options was really around the geographic distance and location of care, as well as the star quality ratings, which was one of their goals in their awareness and providing information to parents about the ratings that the state provided around quality, and using this information to continue to examine the resources that they're providing to parents to help them around their child care search. Sorry, this thing is very sensitive. So as the director of the Early Childhood Data Collaborative, a lot of my work focuses on supporting state policymakers in the development and the use of coordinated early care and education data systems at the state level. Our goal is to help states and policymakers transform the data that they collect that's traditionally used for reporting requirements into improvement-driven data systems, which can really provide feedback and that can be used to guide decision-making of policies at all levels. And so the previous examples that I gave, a lot of those were developed collecting data from multiple sources, and there's always this challenge of capturing children across all of the programs and being able to answer some key questions and the limitations of data that's available. So there's been a lot of focus on improving these data systems. And one way we've gone about looking at states' capacity is that we've developed these 6 policy questions on the slide here to assess whether states have the data that they need in order to have an improvement-driven data system. So are policymakers, states able to know whether children are entering school ready to succeed? Do people have a sense of what the access is to high-quality programs, and how much efforts to improve the quality of programs is happening over time, and what are the characteristics of programs that are providing high-quality care so that these can be used as models for other programs? The last 2 questions really focus on looking at how prepared is our early childhood workforce, and then also having the data on our early childhood workforce and able to look at policies and investments and whether or not that's leading to a more skilled workforce. So I'm going to quickly go through the next slide. So this graphic shows basically what I was saying before, that most of the data that states have are fragmented. But with race to the top in investments and investments at the federal and state level, states are working to coordinate this data so that you can have more comprehensive data across all early childhood programs, but also be able to connect with other services that children and families may be receiving, and then also how children are faring once they enter school after participating in early care and education programs. The fact that this information is currently disaggregated means that policymakers can't answer critical questions about program access, workforce development, or school readiness needs. But the good news is that states are moving to be able to collect more coordinated data, and then they're also using that data in innovative ways, using maps to be able to display where child care services are and also the reach of different early childhood programs. This map reflects some information that the survey that we had done to get a sense of what states' capacities were to collect coordinated data. Pennsylvania was a state that had the most comprehensive data. The purple shows states that were able to coordinate across some of the programs, but not all of them. And then the blue is really those that are planning, and the purple and the orange are states that weren't quite moving forward at the time of the survey when we conducted that. So I wanted to provide 2 examples of 2 states that are actually received Early Learning Challenge grants and focused on data coordination as one of their priorities. And I've included links to both of those sites so that you can check out the tools more in detail. In Maryland, they have an early childhood data warehouse that tracks their child program and workforce data. It includes all of their early childhood programs as well as mental health, childcare licensing, and accreditation data. And they've been able to expand it through their Early Learning Challenge Race to the Top. The data, their childcare licensing data, is available through an online childcare mapping tool, and this allows for parents to be able to show where licensed programs are located and to provide information around the services that are offered. Parents can search by school district, address, program type, and also by quality standards. So you can see on this map the colors represent family childcare or center-based programs within a 3-mile radius of a particular elementary school. And then the last example I wanted to give was from Illinois. They have an early childhood asset map that they've had for a while, and they're looking to update this using their coordinated data system to get more precise numbers on the number of children needing care in the different areas. This is not a mapping tool that's really used as a child care locator. It's really used to answer planning questions such as where additional child care slots may be needed, and then what programs should be expanded based on a similar sort of identifying of specific risk factors in area and then what services are currently available. When they complete their coordinated data system, they're going to be able to get a more precise count of children, and they plan to link that information to this current GIS mapping tool that they have when that becomes available, which I'm excited about. So those are some examples of how Child Trends has used mapping in our work with states, and then also how states are integrating GIS mapping into their coordinated data systems and really using that as a means to transform what is a lot of data into actionable information for policymakers and then also for parents. Here's my contact information, and I will hand it over for the next presenter. Thank you.
Thanks so much, Carlise. And I just want to take a moment to remind everyone to please type in any questions you have into the control panel and GoToWebinar, and we'll get to them after the third presentation. But please feel free to type them in as you think of them. So our second presenter is Michelle Canavino, who's the Operations and Outreach Specialist for PRE4CLE, a plan to ensure all 3- and 4-year-old children in the city of Cleveland have access to high-quality preschool. She coordinates the organization's communication plan and supports its advocacy efforts. And previously, Michelle was the liaison for the Center for Educational Leadership at Cleveland State University, and she's also a former middle school teacher in 2 Ohio school districts. So welcome, Michelle.
Thanks so much. Okay. Sorry, let me just get this set. Well, I'm really pleased to be a part of this webinar today to discuss how PRE4CLE uses data to drive Cleveland's preschool expansion. And I'm just going to start with a brief overview of PRE4CLE for those of you who are unfamiliar with us. PRE4CLE is a plan to ensure that all 3- and 4-year-old children in Cleveland have access to high-quality preschool. It was launched in 2014 as part of the Cleveland Plan for Transforming Schools, which is Cleveland's school reform plan. And that plan articulated preschool expansion as a goal, but it didn't provide specific strategies around the goal, which led to the creation of PRE4CLE. PRE4CLE is a true public-private partnership. We were created by over 60 individuals who represented early learning, K-12, government, philanthropic, nonprofit, and the private sector, as well as parents and educators. And it's currently led by the Cleveland Early Childhood Compact, which is made up of 40 partners and chaired by Eric Gordon, who's the CEO of Cleveland Metropolitan School District, and Marcia Egbert of the Gunn Foundation. PRE4CLE has several strategies that we use to meet our goals. For families, we work to raise awareness about the importance of high-quality preschool and help them find the right preschool for their child. For providers, we provide resources to expand capacity and connect them to quality improvement supports. And for the community, we lead a collaboration to coordinate available resources, advocate for additional funding, and create new opportunities for Cleveland's preschool children. When we started, only 50% of children in Cleveland were kindergarten ready, and only 23% of Cleveland's children were in high-quality preschool, and that's represented by that right-hand bar in the graph there. We also found that 20% of high-quality slots were unfilled, and that there was unequal distribution of high-quality preschools across Cleveland neighborhoods. Our work is very data-driven, so we have child and system-level benchmarks built into the plan that guide our work. So our child-level benchmarks, the first is that children will show significant developmental gains before kindergarten, and that 2/3 of children are scoring above the county mean on a kindergarten readiness assessment from our baseline of 32%. And then system level, we want to enroll 2,000 additional children and target underserved Cleveland neighborhoods. We're really lucky in Cleveland that we have a rich data set called CHILD, which stands for the Childhood Integrated Longitudinal Data System. And that allows us to dig into all kinds of questions we have about kids in our county. So it includes all children born in Cuyahoga County since 1992. Cuyahoga County is the county where Cleveland is. And it uses administrative data to monitor program delivery and outcomes. This allows for longitudinal analyses. And it started with a focus on young children, but recently youth and transition into adulthood has been added, as well as linkage to parent records. It currently includes 500,000 children, and it's managed by the Center on Urban Poverty and Community Development in the Mandel School of Applied Social Sciences at Case Western Reserve University. A key feature of CHILD is the data security measures maintained as part of the system. Privacy is protected through various tactics to avoid identification of individuals, such as using data only in the aggregate and compliance with IRB rules. So this graphic illustrates how CHILD works. Most children touch systems at a variety of points in their life, such as birth, childcare, possibly child protective services, home visits, medical appointments, pre-kindergarten, school, after-school programs, and the CHILD system tries to bring together data on the experiences of children and their families from these interactions. Data partner agencies extract various types of individual records from their systems in the formats that are convenient to them and then submit them. And the digital records are then transmitted to the center at Case Western, where they go through a cleaning and linking process and are assigned a unique identifier, which serves as the connection to each child's record across data sources. This graphic shows that, how this sort of plays out in the long run. The end result is a longitudinal data system where children are observed over time as they're served by one of the administrative systems that contribute data to the CHILD system. And this gives us a cradle-to-career perspective on the children in our county. So I'm going to provide just a snapshot of some of the data that we're using right now. The first is assessment data that we look at kindergarten readiness. So PRE4CLE uses the Bracken School Readiness Assessment, which is designed to assess a child's readiness for school by evaluating the understanding of a number of items organized into 5 categories. Children receive subscale scores on each category, as well as a composite score based on overall performance. And it's administered twice a year, so we can look at change over the course of the year in addition to kindergarten readiness. Because of the CHILD system, we're also able to look at Bracken data subgroups by gender, race, blood lead levels, and others. And at the end of year 1, 80% of children in PRE4CLE classrooms are on track for kindergarten readiness. Given our core goal of preschool expansion, we also track enrollment data. These data come to us from individual preschool providers and include their total number of seats, the number of children enrolled, attendance for some sites, which allows us to get a dose variable, the utilization rate, full and part day seats, anticipated changes due to funding or other system changes, and neighborhood data, which I'll discuss next. And after year 1, we have expanded the number of high-quality preschool seats by over 1,000, and our enrollment in high-quality preschool has increased by 10%. One of our benchmarks is to target underserved neighborhoods. We have to track the data at a neighborhood level. This map shows the percent of high-quality slots by neighborhood and has high-quality preschool provider sites layered on top and listed by provider type, such as Head Start or public preschool. And maps like this allow us to facilitate conversations about expansion decisions and target our resources for expansion to neighborhoods most in need through what we call our classroom startup grants. And these grants we award to existing high-quality providers in high-need neighborhoods that have the space to expand but need the resources to do so. This map also allows us to think about and identify barriers to expansion, such as lack of building stock, and create strategies to address those barriers. This next map shows the percent of preschool-aged children enrolled in high-quality preschool by neighborhood. And maps like this allow us to identify the barriers to enrollment, such as transportation, and create strategies to address these. We can also look at the previous map and this map over time and see how these maps change and the progress that we're making. Another feature that we have with these maps, and because of the child system, we can map data across neighborhoods. So, for example, Case Western has looked at blood lead level by neighborhood. Or we can overlay data, for example, to see if there's a correlation between blood lead level and kindergarten readiness by neighborhood. And finally, I want to discuss our work with Cleveland Neighborhood Progress to look at how transportation might be a barrier to preschool. So this first map shows where kids live, indicated by the heat mapping, and has a public transit overlay. And then we're going to zoom in on the Glenville neighborhood, indicated there. So you can see on this map, which is just the Glenville neighborhood, again, the heat mapping for where kids live. This is a high-density neighborhood. And on top of that, you can see where our high-quality sites are located. That's those yellow stars. And how public transportation fits into this picture. So we have our bus lines indicated by the dark blue lines with the stops in light blue. And then our rapid transit line is in pink. The main questions that we're hoping to answer with this research on transportation are: how far are children traveling to get to preschool? What are the transportation options for children in each neighborhood to reach a high-quality preschool, including how close are high-quality preschools by driving, public transportation, and walking options, and other things. Oh, and what are possible solutions to improve transportation to high-quality preschool in Cleveland overall and by neighborhood? Some of the other things that we're looking at include how many kids are going to school within their own neighborhood and how many kids are leaving their neighborhood to attend preschool. Are preschools located near where kids are living? Are there physical or perceived barriers that keep children from attending preschool? And what role does quality play in the choices families are making about where to send their children to preschool? And we know that as great as maps are, maps don't capture the whole story about transportation. So we're also using surveys to unpack this issue more. So for example, we're asking questions of parents like, if you drive to school, what does that really mean for you? Do you own that car? Do you have an unreliable car? Do you share a car? Do you face barriers because of gas money, etc.? So we're really excited about the research that we're doing with our partners and the results that we're seeing so far, and I look forward to your questions. And here's my contact information if you need it later. Thank you so much.
Thanks so much, Michelle. And thank you to everyone who has typed in a question for Michelle or Carlise. We'll get to as many of those after Elliot's upcoming presentation. So our third panelist here is Elliot Weinbaum, who's the program director for the William Penn Foundation. As part of the foundation's Great Learning Team, they focus on improving educational opportunities and outcomes for students from early childhood through high school in Philadelphia. Prior to joining the foundation in 2013, Elliot was an associate commissioner at the U.S. Department of Education, And he also spent more than a decade as a researcher and faculty member at the University of Pennsylvania's Graduate School of Education. So Elliot will be sharing with us the data-driven approach to mapping early childhood education that his foundation has funded in Philadelphia and which is now being replicated in other parts of the country. So welcome, Elliot.
Thanks, Kristen. Just a word about the William Penn Foundation, where I work. William Penn Foundation is a family foundation based in Philadelphia that's invested in education, the environment, and arts and public space for more than 70 years. About 3 years ago, we took a step back to think about how we could improve access to quality early childhood education for all children in Philadelphia, with a particular emphasis and particular attention to children who are living in low-income families and communities. And what we found when we took that step back was a lack of information, a real dearth of information to guide our future steps and our future investments. And there were needs in several areas. So first of all, there was no comprehensive source of local child care options. Even though many people pointed to a list that the state compiled, what we found later is that that list included about 2/3 of the local child care options in Philadelphia, only those that had gone through a particular state certification process. There were multiple sources within the city and nationally that pointed us in the direction of child care options that existed for families. And there was no data at all that was available on the capacity of those child care centers, their distribution across the city of Philadelphia, and how accessible they may be to families, particularly those without private automobiles. There was also no information about how supply and demand might be related. Once we understood the distribution, both of the supply of quality care as well as where children, particularly children aged 0 to 5, were living, how were those related and where might there be particular gaps? And finally, though we knew a good bit about the supply of high quality seats, we didn't know what proportion that might represent of the overall supply in the city. So our goal for setting up some information source was to develop this for the use of providers, that they might understand their market more completely, for the use of policymakers, both elected and appointed officials who had a real desire to expand access to quality care for young children in Philadelphia, for advocates as they pointed people in specific directions where education was needed, where access may be needed, and where information and resources may be needed, for funders like ourselves who were interested in making the most impactful investments possible, and for parents who were really looking for a single stop where they could go to understand their childcare options in close proximity to their homes or to their places of employment or along their routes between those things. And the overarching goal was really to use data to inform planning that was happening here, resource allocation, as well as advocacy work. And so we were fortunate enough to partner with Reinvestment Fund to begin this work, and also to partner with a stakeholder advisory group representing members of our community that were convened by United Way, providers, advocates, city and state officials, to come together to talk about their needs and priorities, what information gaps they were sensing in the city, and how those could be filled. And together we built on Reinvestment Fund's PolicyMap platform, which gave us a very strong starting point for demographic and municipal information. As I mentioned, there was not at that time a comprehensive measure of the supply of childcare, and so we really had to draw on at least 6 different data sources that are listed here. The most complete was from the state of Pennsylvania, the Office of Child Development and Early Learning, which, as I said, had about 2,000 child care centers identified across the city of Philadelphia. The school district had its list of Head Start and partner sites. The Pennsylvania Department of Education has a separate set, Head Start nationally, and then proprietary databases including Info USA, which really are listings of businesses that are operating and have particular codes for child care providers in particular. So all of that had to be combined to come up with a composite of the supply of child care in Philadelphia. The OCDEL, or that Office of Child Development and Early Learning data, as I mentioned, was most complete, and some of the proprietary information sources had to sort of be analyzed and use inferences to estimate what the capacity of those sites might be based on staffing numbers and other information about the center, because child capacity was often not provided. So what did we learn about supply? Once all of that information was compiled, we learned that there's space for about 100,000 children in Philadelphia. About 3/4 of that space is in certified child care centers and a little more than 1/4 in not certified centers, which would be, again, those private businesses that are largely private businesses that are operating throughout the city and that are being utilized by parents across the city to care for and educate their children. If we just look at the certified supply, we saw that the minority was in high quality seats. As you can see, the 24% there in the pie chart was what we learned is really the proportion of high quality care options that were available to families, and then about evenly split between lower quality and those centers that are not involved in the quality rating system of the state at all. The mapping allowed us to provide pinpoint information, and if you go to childcaremap.org, you can see the little logo in the upper left there. It's accessible information to everyone. And so one of the things you can do is just sort of see where the child care centers exist, along with transportation routes and all of the street grid that exists throughout the city. People can put in their addresses, they can put in particular points on the map or radius from a particular point, and get the listing of centers that are in their community by star rating, which is our state's quality rating system, in which star 3 and 4 are generally understood to be high quality, 1 and 2 are sort of on their way to high quality. So that was one piece that sort of helped us to just understand where are all the centers. As I said, we learned that there are about 3,000 centers across the city of Philadelphia providing care and education to young children, 2,000 of which are formally certified by the state. But we were also interested in the demand, right? Where are kids and where do they need childcare? And as with the supply question, there was no single place to turn for that. Started with just basic population and age data from the census about children under 5, but we wanted to understand also, because those children sometimes come with their parents to work, or if their parents work outside of Philadelphia, perhaps they leave the city and the children accompany the parents there. So combining a number of different sources that you can see here, we had a sense of where people are moving both in and out and within the city, and tried to estimate those who may choose to have their children closer to home versus closer to work or somewhere along the way. So from the estimate of the total demand, we learned that there are about 105,000 kids under 5. Another 9,000 are probably leaving the city as their parents, who are city residents, go outside. 16,000 who live outside the city may be coming into the city with their families to work. And so then we had an understanding of the total estimated demand being about 113,000, which is quite close overall to the supply. If our estimates are all correct, perhaps demand exceeds supply somewhat, but overall a close relationship there. So our next question that I mentioned was sort of where are the gaps across the city? If overall in Philadelphia we know that the supply and demand are relatively close, can we understand where there are particular either surpluses or deficits of supply? So the table, the image that you see in front of you, if there were a perfect match between supply and demand in every block group across the city, those little blue diamonds would be lined up perfectly along the dotted line that cuts across on the diagonal. The truth is, because demand exceeds supply somewhat, the actual regression line there is the solid line, or closer to the solid line probably, and each blue diamond, as I mentioned, is the illustrates the relationship between supply and demand within any given block group. Those that are above the solid line would be those that have a greater supply than might be otherwise predicted. Those below the solid line have a less than expected supply in those communities, so those are the ones that are probably most in need of immediate expansion of high quality supply, or overall supply and high quality supply in particular. So we were able to sort of analyze those gaps and, even more excitingly, to map those gaps. And so here in this map, which again is data that you can manipulate at childcaremap.org and look at different demographic features that may be of interest to you, but the absolute shortage in high quality childcare is illustrated by the sort of blue to white shading. Those areas with blue, so the city overall has a deficit, so this is all sort of relative, if you will. Those areas in blue have the least deficit. Those areas in white have the largest deficit. And the orange overlay helps us to understand where are particularly high areas of residential poverty, or residents living in poverty. So the places that are shaded in orange and sort of have white underneath them are areas that are particularly high poverty and experiencing particular deficits of high quality care. For us at the foundation and for many people throughout the city, those would be areas of needing particular and immediate attention. Obviously, as I mentioned, the city as a whole needs expansion of high quality options, but when we think about children at risk, and of course poverty, living in poverty is just one of those risk factors, these are areas that we really need to attend to in growing services for children. So we Reinvestment Fund is tracking this data over time, so we've just finished our first year, really, so we can understand how change happens over time in the community as a result of investments and efforts that are being conducted not just by us at the foundation, but by certainly municipal leaders and providers, advocacy organizations across the city. So we can see a small change from 2014, right? Just 128 seats overall added. But what we also see here is that there's been growth in the percentage of certified seats, which implies a closer relationship with the state regulatory body, which may in fact be a good thing in some cases. We also see growth in the high quality category in particular, which is of course one of the driving forces of our work. The map also now includes information on expansion opportunities, so it highlights sites in the city that may be particularly amenable to use as a high-quality early childhood center. It also, as I mentioned, includes transportation options for families and can visualize change over time, not just at this macro level, but at various neighborhoods throughout the city. We found the mapping and data that's been collected by Reinvestment Fund and analyzed to be extremely useful. It's really informed the local universal pre-K effort. Philadelphia is on the cusp of expanding access to high-quality education to all 3- and 4-year-olds throughout the city, and this data has helped us to understand and help the city to understand where particular areas need to be prioritized. The map and data have also helped local entities to increase support for early childhood education. They've been useful in federal grant competitions, such as the Early Head Start Childcare Partnership and Head Start Renewal competitions, as well as other local grant competitions, for example, PNC's Grow Up Great effort, where people have been able to identify areas and communities of particular need, and as a result of this effort. It's informing investments in libraries, parks, and playgrounds around the city as we think about where children have access to, where children are living, where they are spending their days, and where they may or may not have access to other parts of the municipal infrastructure. It's really helped us to plan and understand more about the connection between our early childhood education and our K-12 systems. So, for example, we can look at a particular elementary school and now for the first time understand all of the early childhood education sites that are within a block or a mile or a half a mile of that school, and think about the relationship between that school and its surrounding education providers for children before they enter kindergarten. Or it's been a resource for parents and caregivers. As I mentioned, childcaremap.org is available to caregivers throughout the city, and the data that has been compiled has also been used by other providers who do even more intentional direct outreach to families and communities, and now can provide them with comprehensive information for the first time. And it's been very helpful for us as a funder as we've made other investments in things like the Fund for Quality, which facilitates high quality program expansion of early childhood throughout the city, or Success by Six, which is a technical assistance effort to increase the quality of child care centers, and we can sort of target those investments in more thoughtful ways in order to reach populations most in need, and we can also track the impacts and success of those efforts as we seek to close the gaps between the supply and demand in high quality care. Thanks so much.
Great. Thanks so much, Elliot. And here's a slide with his information in case you want to contact him, as well as the email address for Emily Dowdell, the representative from Reinvestment Fund, who can provide more answers about the data analytics in the mapping tool. So thank you so much to all three of the presenters. They were all very fabulous, and we are now ready for the discussion part of the session. We have had quite a few questions come in, so I just encourage the speakers to be somewhat brief in your responses so we can get through as many questions as possible. So to start, there have been quite a few questions coming in regarding quality and the question of kind of what factors go into your assumptions about which pre-K centers in Cleveland are high quality. And I was hoping you could speak to that, Michelle. And it also ties to another question about outside of the public rating systems, which, if you don't want to rely just on that, if any of the panelists could speak to other ways of assessing quality, since clearly the quality rating system is not the only source. So Michelle, would you want to answer the Cleveland question?
Sure. So in Cleveland, for PRE4CLE, we define high quality as 3, 4, or 5-star rated sites in the state's rating system, which is called Step Up to Quality, and that's a 5-star system.
Michelle?
Yes. Oh. Hello?
I can hear you, Michelle.
Okay.
Yeah, we can hear you, Michelle. Sorry about that.
Good. No, that's okay. Sorry. So we define it as 3, 4, or 5-star rated in the state's quality rating system, which is called Step Up to Quality. So that's how we define high quality in Cleveland in PRE4CLE.
Yeah, and I would say in Philadelphia, we also rely on the state quality rating and improvement system. Ours is a four-star system, and we consider 3 and 4 to be high quality. We, at the foundation, in fact, funded an analysis that was conducted by researchers at the University of Pennsylvania to look at the relationship between those star ratings and child outcomes, and they did find 3 and 4-star centers to have stronger pre-academic outcomes than 1 and 2-star centers, so that gave us some confidence that, in fact, those higher quality centers were preparing children for school more readily. We don't have any other comprehensive source of data that would help us to assess program quality on a large scale as we think about 3,000 different providers across the city.
This is Carlise. I would say for the examples that I provided, most states are using their quality rating and improvement systems to convey different measures of quality. I would say they're all different. Generally, I would say most use licensing, that it's a licensed provider as the base for their initial stars, and then depending on the system, the additional education or environmental rating scores, or family engagement activities, or specific training of staff and directors vary from state to state. But that's showing what states have been using to evaluate the quality of programs. I think before the QRIS rating systems, a lot of state childcare resource and referral agencies provide information to parents on specific components of quality to look for as they're looking at childcare providers. So I think for states that don't have quality rating and improvement systems, I think providing guidance to parents on different components to look for, and then providing as much information kind of in the childcare searches is a helpful way for putting it in the parents' hands of what type of information they can look like and making that based on what their specific needs are for their child.
Great, thanks so much. So we have another great question from Josephine, which is, what are the ways you have found most effective to share these maps with people in power to make decisions? And I think that could go to any of the panelists.
I could jump in here. This is Elliot in Philadelphia. We have engaged in a number of citywide convenings that have been open to the public, and city leaders certainly included there, to help them understand not just this data source, but a number of data analyses that the foundation has funded to better understand the supply, the demand, and the obstacles to the provision of early childhood education throughout the city. And those have been very well received. And as I say, as the city has engaged in a universal pre-K effort that we're just at the very beginning stages of, we've seen how this data has been incorporated in some of the planning that the Universal Pre-K Commission has begun.
This is Carlise. For a lot of states that we've worked with, it's been really helpful for them to display their data using the legislative districts of their policymakers. Definitely whenever they're going for meetings or presenting information or informing their policymakers on a particular issue, having their specific district is always helpful. I think, just as I was talking before, there's always sometimes challenges about what data you can get at what level. So I think that's sort of just one of the barriers, but I think being able to have it by those different policy districts, or whatever the level of analysis that's most helpful in conveying that. So I think it's just not always doing statewide or just by county, but really tailoring the map geographics for your particular audience.
Yeah, thank you, Carlise. If I could, I just wanted to build on that one thing to say that during the planning effort for this entire data analysis project, we incorporated people from the school district, from the city, and from provider communities across the city, and had an explicit conversation about those units of analysis that would be most relevant to various audiences. So on childcaremap.org, you can look by councilmanic district, you can look by school catchment area, you can look by zip code, and people can choose the unit that is most relevant to them, or citywide if that's your area of concern. And that indeed has proven to be very meaningful for various audiences.
Yeah, and in Cleveland, we are in the process of meeting with a lot of our city council members, where we're sharing these maps about what's happening in their ward. You know, we also have on our Early Childhood Compact, which is our governing body, we have a lot of representatives from the city and the county and foundations and that sort of thing. So we are already in a position when we share these maps with the compact to sort of move this work forward. And with our transportation work, we're really still in the early stages of getting that done. So we'll see where that goes coming up in the next couple months or so.
Great, thank you. And there's a question from Nathan for Elliot, wanting to know where the childcare map analysis has been replicated, and if the process unfolded in a similar way with an advisory board forming, et cetera.
So as far as we know at this point, Newark, New Jersey, Passaic, New Jersey have replicated similar efforts. I don't exactly know the details of the way in which those plans and analyses rolled out, but they have created a similar platform for publicly accessible data that shares many of the elements of childcaremap.org. We've had conversations with a number of other communities. We at the foundation, as well as the reinvestment fund, have had conversations with a number of other communities who have been interested, haven't yet created this, but certainly see the value of it for their cities.
Great, thanks, Elliot. And along similar lines, a question for Carlise from Laura about how at Child Trends you select which communities you work in.
Child Trends receives funding from a lot of the large foundations. We also work with state and local, federal, state, and local government agencies. Part of our work are specific research projects that we do, and others are work that we do specifically for a state. So for example, for the Early Learning Challenge grants, a lot of states are working on validating their quality rating improvement system, kind of I think what, I forget who had mentioned it earlier, I think it was Elliot, where really examining how the levels and the components of each of the levels of quality translate into what higher levels based on 1-star versus 5 stars. So we're doing QRIS evaluations in about 6 states to provide support to states. So part of it are requests for research support that we respond to, and part of it are specific foundation or research grants that we have to examine a particular issue in a state.
Great, thanks, Carlise. And this is another question that could be for any of the panelists, but it's a comment from Risha Berry about her appreciation for all of the maps that have been shown today, and saying that in her city they're working on this, but they're at the emergent stage, and wondering if there's any advice from the panelists about where a city would begin, which assumably would depend on the size of the city, but if any of the speakers could speak to that, that would be great.
I could speak to that. I think, this is Michelle from Cleveland. I think what we've found is, and it sounds like this is similar in Philadelphia, it's really about getting the right people at the table, especially when you need to collect a lot of data from a lot of different sources to really do these maps well. So making sure that you have all the right people in the room who can work this out and get the mapping and the data collection done as efficiently as possible is really important.
Yeah, and this is Elliot in Philadelphia. I would just add that absolutely echo Michelle's point, and also offer that as a starting point is to get familiar with the data sources that actually exist and how comprehensive they may or may not be. I will say that when we got people together around that table, as Michelle suggested, there was more than one who said that this was unnecessary effort and investment, because I think that they believed that the comprehensive data sources, both for supply and demand, were more easily accessible than in fact they were at that time. And so we sort of had to get a better understanding of what existed in order to make the case both for the need and the potential that such a project would have. And I think we've won them over with the creation of childcaremap.org, but there definitely was that initial resistance. And so I think it's important to make sure that you have accurate information as you begin those conversations with stakeholders to inform the direction that such a project might go.
And this is Carlise. I would just echo both what Elliot and Michelle said, and just as we're working with states, I think the stakeholder engagement piece that Michelle mentioned is really key. But I think what we encourage people to do is to start with really what are your priority questions that you want to be able to answer with this data, and then based on those questions, then start to identify what currently exists. And I think what we found with a lot of states is that sometimes the data that you need to really answer that question doesn't currently exist. So really being able to map out sort of what data assets you currently have and then where the gaps are. And then that can really guide maybe what questions you maybe move forward with first, depending on the immediacy of your needs and your goals, and then what do you really have to move forward with as far as more of a planning process, and really getting at the right data for your specific questions.
Great, thank you so much. And there are a lot of other really, really wonderful questions, and we will certainly get back to everyone who asked them. I will be sure to forward them on to the appropriate presenter, and you will definitely get answers to your questions. It's been a really excellent conversation today, and I want to thank our 3 presenters. I hope everyone in the audience has found it to be valuable. As I mentioned earlier, the webinar will be available online, and we will also send out the video link and presentation slides to all of the attendees. For those in academia and backed by popular demand, our next map chat will be in October, and we'll be focused on using PolicyMap in the classroom. We'll be sending out a sign-up link for that soon. And I also want to take a moment and let everyone know that in addition to these webinars and the creation of childcare-specific tools like childcaremap.org, PolicyMap offers quick and easy mapping and data visualization tools both for free and at various subscription levels. We also offer site licenses to cities across the U.S. with customized access to data related to demographics, income, education, and more. If you have not yet done so, I would definitely encourage you to sign up for a free 7-day trial of PolicyMap to explore how it can help you and your organization use data to make smart decisions. So thank you again to everyone for joining us today, and please do follow up with any questions once you get our email. Have a wonderful afternoon.